Hello, everyone, and I wanted to say a warm welcome. I am thrilled to be here with all of you, and I want to welcome you to the Nurse Leader Listening Tour hosted by Sharon Weinstein and I, where every Tuesday and Thursday at 12 noon we bring you an outstanding, innovative nurse leader who will share their thoughts, their insights, and ideas for putting the health back into healthcare. Sharon and I are experts at facilitation of critical strategic thinking, where we know solving the right problem will give us different successful outcomes. Our studies indicate and prove that when we solve the right problem, that there brings critical change needed for today's leader that supply the critical health care both for now and in the future. Sharon and I created a listening tour to give exceptional nursing leaders a voice. Today is no different. I want to extend a very warm welcome to Dr. Sheila Burke. Sheila, welcome today. I'm so glad
Thank
you could
you.
join us.
Thank you very much. I'm thrilled to be here, truly.
Awesome. Well, I want to share with people just your background, which is incredible. So I'm going to try to see if I can do it justice, which probably not, but I'm certainly going to give it a college try. So she is renowned. Dr. Sheila Burke began her career in home health care and hospice care. She's very much around strategic planning and organizational development. She's been in the hospice space. She's been VP of clinical palliative medicine in San Diego. She's been a director of home health, BNA Chicago. She's been the Dean School of Nursing at Kaplan Higher Education. She completed her doctoral program focusing on development of executive leaders. She's a dean at Carrington College Nursing Program, VP of Nursing Education with states all over the United States. And she's an executive healthcare consulting and coaching specialist in nursing education. Finally, something very important, she has an incredible background with stress reduction and really around that mindfulness that she has gotten from a program by John Kevison. So, welcome again, Sheila. It's incredible to have you. And I want to open up with a critical question because you've seen the world for many years through nursing. And I want to get some input from you about what has changed based on your experience over the last 10 to 15 years.
So I am just delighted to be here, and I think this is really a timing issue that right now is exactly what we need to do is think about how nurses that have been in leadership positions can use their voice to help the profession. I've been in nursing education a long time, and I think I can say that in the last 10 to 15 years, the changes have been dramatic. Um, the fact of how much more science there is to know now than 10 to 15 years ago, there's been an explosion of healthcare science. We know so much more about the human body. We have the same number of muscles, the same number of bones, but we have so much more knowledge about genetics, pathophysiology, drug interactions, the genetics of drugs. We've expanded the amount of treatment available for chronic illnesses. We're living at a time where in the 1990s, everybody that got AIDS died when the 5-year mortality for cancer was so high. Now we've got people who have metastatic breast cancer and people who have brain tumors and pancreatic cancer, and they're living lives of purpose and meaning far beyond anything. And what this boils down to is nurses have to know more. So the science of teaching nursing students and the ability to prepare people to be effective, safe nurses has really changed. And then that all accelerated with COVID because it was not just that there was so much more to know. I mean, when you think of it, 3 to 4 years ago, nobody was talking about COVID, you know, and all of a sudden we had a whole new dimension of illness that we had to measure and therapies we had to deal with. And nurses who had never thought they'd look at a ventilator were all of a sudden having to be experts in ventilatory support. So all of this has, it's impacted nursing education. It's changed the way that we look at how we deal with patients. And then from a societal perspective, nursing education has to wrap its arms around social determinants of health and realize that lifestyle, that the modifications to lifestyle are going to be the only path we have to improve the quality of health and life. across the globe.
Mhm.
So if, the challenge today is people who are involved in nursing education have a higher level of accountability to develop learning programs and student support that's more effective for a more challenging profession. Nursing, healthcare, period, is a more challenging field than it's ever been.
Mhm. Yes. I want to go back to something that you spoke to, which I think is really important, the social determinant of healthcare. Speak more about that a little bit more, Sheila. What are your thoughts on that?
Um, that is really important to back up and look at the data that we have that is very painful about that where a person is born and who their parents are and the level of education and opportunity that they're afforded has a direct impact on their health. So I live in the Chicago area, and there's been a lot of research done over the last probably 10 years. Depending on your zip code, when you live in a place like the Chicago area or New York or Philadelphia, or Los Angeles, depending on where you live, the quality of your health is determined by things like the level of education, the amount of economic resources, the nutritional resources that are in the community. So when people are not, when there's not a social system that supports good health, you have situations like in some of these urban centers where children aren't making it in, they're not to the middle of grammar school before they're overwhelmed with issues because they're poorly nourished. They're suffering from PTSD because of the shootings in their neighborhood. They have family structures that have been strapped by generations of not having the appropriate kinds of opportunities for
Mhm.
employment.
Mhm.
So when you have financial and societal and lack of opportunity because of endemic racism or disparities because of language challenges, all these things really affect a person's health status.
Mhm.
So, I think that has to be part of the dialogue when you're teaching students.
Mhm.
They need
Mhm.
to be able to see the patient and the family as a unit and understand where are they coming from and what are the things that are going to affect their health. When you take people that have illnesses like diabetes or chronic kidney failure, and you put them in an environment, or AIDS, and you put them in an environment where they have proper nutrition, social support, it changes things.
Mhm. I love that. I want to go back to the healthcare worker too, because we talked a little bit today, kind of before we got started, around, how do we put the health back into healthcare because truly it's broken. And I'd love to get your thoughts on, what is the evidence showing us today about how can we do this, and what's the accountability of leaders?
Well, I timing is everything. So I knew that this interview was coming up, and I received my copy of the current issue of Health Leaders um, Journal. And this journal, the cover story is called The Business Case for Clinician Wellness. And one of the people that I admire very much, Dr. Bernadette Melnick, who is internationally renowned as a nurse science researcher, and is an expert in evidence based practice. This is the story of how Ohio State University and healthcare systems in Ohio are changing the format of health for the healthcare professionals. So, this is about nurses, but also about other healthcare professionals.
Hmm.
And it's about putting health back in healthcare. So, the evidence is in this article. She talks about the return on investment. When a healthcare system addresses the issues within its environment and it looks for ways to create support, physical fitness, physical activity, better nutrition, and stress management. It has an impact on the healthcare workers' health, their resilience, their persistence, and the retention. That directly impacts patient care. So when nurses feel supported and they're centered and they're well nourished and well rested, the level of care they give is different. So this is crucial. And, the article is exceptionally well written. It references a number of other large healthcare organizations. So I'm really glad you're asking this, Dina, because the evidence is here.
Mm-hmm.
Nurses who report having wellness supported workplaces are 3 to 9 times as likely to experience good mental and physical health. So in my journey, one of the things I did when I was a kaplan was I worked with our administrative team, and we held wellness fairs. We had yoga instructors, we had physiatrists, we had nutrition counselors, we had naturopaths, and we did deep relaxation breathing. And we brought these people in and we set up a fair for employees of the university. And that included, we had nursing faculty and nursing students, and they participated in these events. And it was to bring an awareness that they could make choices that would improve their sense of well-being. So it starts now. We're really desperate.
Yeah.
We need to make these changes now.
Yeah, most definitely. And just looking at just the fallout, everybody knows that it seems like in healthcare, everybody's looking for something other than healthcare. Even though they come in as a nurse, we hear a lot of people, trying to get out just because of the stress of this. What would you say to people who are reluctant to speak up for the things that they need and they want?
That is a big challenge. And I think, to be able to be calm and reasonable and to avoid getting into ultimatums, but I think using evidence, being able to look for exemplars, like if somebody wanted to start a wellness program, look at what they're doing at Ohio State, look at what they're doing at Stanford, look at these examples that are out there right now. You mentioned mindfulness-based stress reduction. That goes all the way back to the 70s at Massachusetts General, where Dr. John Kabat-Zinn started out by doing mindfulness-based stress reduction for people who had advanced cardiac illness. But Dr. Dean Ornish did a very similar model back when he was dealing with people with cardiac illness, where it was a mind, body, spirit. They used physical exercise, good nutrition, and counseling and journaling and mindfulness. And it really made a difference. So there's examples out there. So I think it's being solution focused and not raising the cry of, woe is me, we're in horrible shape here. It's putting the evidence together that by investing in the wellness of the healthcare providers, the institution, the system will do better.
We have a lot of non-clinical people leading health systems. When we talk about that accountability of, what needs to happen for leaders to be able to become more sensitized to that need, right? Because they're so focused on some of that performance metrics. We know everybody has performance metrics. What would you say to the leader who are non-clinical that are running into some of the stress factors of, maybe high turnover, high burnout rate? What would you say to that leader?
I'd say if the interest is at the end of the day that the institution is able to be, to continue and to earn a profit, which there's nothing wrong with having a profit.
Right.
I, admired for years Stephen Covey, and Stephen Covey's line was no margin, no mission. So even if you're working in that for profit, there has to be revenue that is used for to sustain the organization. People that are interested in what is the bottom line in the numbers, again, it's the evidence. If you can implement a system that reduces turnover, that improves staff performance, that improves Press Ganey scores in healthcare systems, those are the things they're looking at. Is so show them how you can impact the numbers by putting the health and wellness in there. And there was a system, couple of different systems that were used. One was called Heart Math, one was called Plane Tree, but these were things where it really looked at helping healthcare staff, nurses, physicians, and other healthcare providers deal with stress in healthy ways and improved communication, and it went right to the bottom line. The hospitals did better.
Right, right, right. So what I heard you say is a couple things. We all need to take a pause and ask, what is really the need here? Because we can look at a lot of things, and to be able to ask a deeper question for everybody, what is it that we need to consider here? Even though the obvious things that we know that we all need to consider, there's quite a bit deeper consideration that we have, and we talked a little bit about that, and I'd like for you to touch on that because it's a really big important issue, and I'd like for you to speak on the word believe, your beliefs and what you believe.
That's really powerful. And I'm sitting here and I'm thinking about the title of your book, you and Sharon's book about Think Differently.
Yeah.
And it's really about taking accountability for what we believe. And the science shows that what you believe has an impact on your physiology. So people who practice mindfulness, who practice awareness of managing their response to stressful situations, have a better ability to make healthy choices. So the challenge right now is that for a number of reasons, our societies tend to foster a sense of that we're victims,
Mm-hmm.
that we can't
Mm-hmm.
change things.
Right.
And I think this is where in every institution, every nurse, every physician, every transport person, respiratory therapist, if we could create an environment where we support each other in terms of being mindful of why am I choosing to believe that,
Yep.
and sometimes we're influenced by the media. The media says, if you don't have this, you're not worthy. If you don't have this,
Right.
you're not accepted. And I
Mm-hmm.
think right now we have a lot of science that's coming out. I am thrilled that we're talking about things about accepting people, transgender, different choices, neurodiversity, people who had to struggle because they didn't fit in a box. They
Mm-hmm.
didn't come across in the right way. We're being much more accountable right now.
Mm-hmm.
But we have to accept people where they are and then support them and support each other. So
Yeah.
I think the challenge for me right now is the pressure on nursing faculty and the pressure on nursing students
Mm-hmm.
and the lack of some of the things we'd like to have. Sometimes people come away at the end of the day and they say, oh, what can I do to change this? And that's an opportunity to say, well, what can I do to change this? Maybe I can do some things.
Yeah.
Maybe I can just take charge of the fact that before I go to bed tonight, I will lay down for 5 minutes and just breathe
Yeah.
and totally relax my body. And what would happen? What would happen if I did 2 or 3 small things a day to feel
Mm-hmm.
better?
Mm-hmm.
And there's
Mm-hmm.
so many ways, the science is there. It's steady, focused behavioral change. And what's fascinating is, when you think about it, people say, well, I can't change. It's really hard for me to change. Well, let's just go back 3 years where when you needed to start wearing a mask, guess what? The majority of us wore masks.
Right.
And we needed to be more
Right.
mindful of washing our hands. And
Yep.
we had to plan our trips to the grocery store and this and this and this. And
Yep.
look at the resilience. Look at the
Yes.
amazing resilience that
Yes.
society has demonstrated and how our capacity to
Yes.
change
Yes.
nearly overnight.
It's very important.
And I think we need to pause and we
Mm-hmm.
need to recognize that within us, we have the capacity to make huge change. And I've seen people who have turned their life around because of something they wanted. Sometimes it's, I'm going to be fit, I'm going to be physically fit, and I'm going to be capable because I want to be able to be active with my grandchildren.
Yes.
Sometimes it is, I am going to give up smoking because this is killing me. So I think people have the capacity to change.
Yep.
I think that the challenge is you can't just have the motivation, and it's not just having the knowledge. There are so many people I know that struggle with addiction to nicotine or addiction to other substances or behaviors. And, but they can tell you that it's bad for them. But you have to start with changing the behavior.
Yeah, I love that. It's not what I heard you say, there's not enough just to have the knowledge, right? So we can even look at the evidence-based medicine that says if we do A, B, C, this is going to create a different outcome for you.
Yeah.
But if you don't believe that and truly believe that you're worthy, and I think that's one of the things, Sheila, is going back to that place of, I am important.
Worth it.
I am worth it. I do
Yes.
believe that, I can take 5 minutes out of my day, my stressful day of
Yes.
taking care of X amount of patients, or people that you're short staffed, right? You're having to do more, even your own job has more duties. Even if it takes 3 minutes out of your day just to breathe, it's a decision. It's a decision you have to make for yourself.
And that's where some of the things that you've talked about and you and Sharon have talked about in these interviews, you can't give from an empty pitcher.
Yes.
And that's a very powerful model. And again, that was one of the things Stephen Covey had in the 7 Habits of Highly Effective People, was this idea that, and nurses can be very much guilty
Yes.
of not putting themselves first. So I'm a member of the American Holistic Nursing Association, and I believe Sharon has been a member and a leader in that organization for a number of years. And this is really important. And I invite anybody, you don't have to be a nurse, you go to the American Holistic Nursing Association website, they have a lot of resources about self-care. And
Yes.
self-care is crucial. You can't be a good mother, you can't be a good nurse, you can't be a good business person if
Right.
you are so fatigued and so overwhelmed and
Mhm.
you're not well nourished. You just, so you look at people who
Mhm.
have been really, truly effective leaders, and they have healthy lifestyles.
Mhm.
They do. The people who sustain um, and persevere, they
Yes.
do make good choices. And
Yeah.
it's unfortunate because a lot of those people, they don't grab the headlines, you know. And I look at, you mentioned a few times, Dina, I've been a lot of my professional career has been in hospice and end of life care. And I remember meeting Dr. Cicely Saunders many years ago. She was in her 80s. She was this beautiful elderly English woman, and she was the founder of Modern Day Hospice. And she had cared for so many people, and she made such huge changes and advances in healthcare. And she never got burned out. She never got burned out. Her compassion was unending. But she was also
Mhm.
somebody, and this goes back to I was thinking about this before. The B is for balance. Dr. Saunders loved art. She loved music. She found joy in things that were simple and accessible, but she fed her soul. She was intentional.
Mm.
She fed her soul. And so, people have said to me, well, how can you be in hospice? You'll get burned out. You don't get burned out. It's like a candle.
Mhm.
If
Mm.
if you find a way to keep your fire lit, you can light lots and lots of fires without going out.
Mm. I
So
love that.
I think this is where, if people are feeling like they don't know where to start with something simple and start with something that's easy to do, and then go from there. And there's probably people that are listening that are connoisseurs of wine or tea or cheese or music, and it's when you start to study something, you learn more and more. And so when
Mm.
a nurse or a physician or a respiratory therapist begins to study how they can
Mhm.
be healthier,
Mhm.
you find more and more, but you have to focus on it. You can't keep putting it to the end. It can't be something that you say, gee, I'm going to be healthier, and then I just don't do anything about it. You have to take action.
You do. And I want to, kind of circle back around for some really key takeaways today because they're really powerful. Number one, the evidence is there. The evidence says, you know what, if you don't take care of yourself, no one's going to do it for you. And that if you do take care of yourself, you can make a change. And you said something too that really hit home for me, and I wrote it down. It's time for people to light your candle, but light your candle for yourself, making a decision to make sure that your pitcher doesn't go empty. Find compassion for yourself, find a connection for yourself, and find some of those simple joys, especially as we get close in during the holidays today. We've really got to stop and just take a look around and find some of the simple joys, but take time to actually breathe because no one's taking time to even take a breath.
That's really powerful, Dina. And because I'm working with nursing education, there was a textbook that came out. It's it's not a textbook, but it's for faculty. It's called an educator's guide to humanizing nursing education. And it talks about students learn best when the teacher cares.
Hmm.
And then it circles right back and says, but the
Right.
teacher that's going to be most effective is the teacher who can teach the students the importance of self-care.
Mm.
And
Yeah.
so what would be the greatest gift I could give somebody if I was teaching them to be a nursing professional is to help them to honor their own truth and take care of themselves
Mhm.
in ways that are healthy, because ultimately the best nurses are the ones who can help patients find a way to take care of themselves, because
Mm. Yep.
it is how we empower other people
Mm-hmm.
that is really our legacy.
I love that. And a takeaway for leadership. Number one, take care of yourself so that it can boil downhill and run downhill onto people that you're leading, but also give them an opportunity to find one thing that can light the candle or fill their cup. If you do that one thing in the next 30 days, you've given them a gift of something that maybe they've not had time to think about in a while.
Yeah.
And as Dr. Sheila Burke says, the evidence is very clear. If we don't take and believe that we can take care of ourselves, we're never going to be able to change healthcare, and we certainly can't bring the health back to healthcare, also including for our own lives. And it goes with us. It starts with us first. And I think that's what you said today.
Yeah. And I just really think that, it's all possible. It's
Yeah.
all possible. And I've been so motivated myself by looking at the lives of some of the people who have overcome tremendous challenges.
Yes.
And I think, all of us can make positive change, and we just need to start, but it won't work unless we believe we're worth it.
Right. I love that. And we want to send back a message to everybody. You're worth it. I
Yes.
wanted to thank you, Dr.
Thank
Sheila
you.
Burke. You're amazing.
Thank you
Thank you for
so
being
much.
with us today. I
Thank
love
you
what
so
you
much.
shared with us. Thank you so much.
Thank you. Take care.
You too.
Bye.